All right, let's dive right into this explainer. We're going to unravel a massive medical mystery that's basically hiding in plain sight and explore a really paradoxical treatment that's completely redefining cellular healing. We're going to look at why so many of us are dealing with this slow, creeping decline in our metabolic health, struggling with weight, rising blood pressure, constant fatigue. And then we'll explore a fascinating intervention that uses the simple combination of oxygen and pressure to literally turn back the biological clock.
But before we get to the solutions, we have to ask ourselves a pretty fundamental question. Is your standard routine blood test completely missing the biggest threat to your health? Think about the average person going to their doctor. They're slowly gaining weight, their blood pressure is creeping up, they're exhausted all the time. The doctor checks their standard metabolic panel, sees the fasting glucose is sitting in a normal range, and just assumes all is well. But according to the research of Dr. Ben Bickman, this is a very dangerous illusion.
So here's our roadmap for this explainer. First, the medical mystery. Then, the glucose illusion. Third, the cellular solution. Fourth, the hyperoxic-hypoxic paradox. And finally, reversing biological aging. Let's get into it. Section 1. The medical mystery. Let's start with the invisible damage happening inside our bodies while we slowly gain weight and our blood pressure rises year after year, hiding right under the nose of conventional medicine.
Notice the stark contrast here between how things are usually done and the actual metabolic reality. The conventional view is, well, entirely glucose-centric. But Dr. Bickman's research reveals that just looking at glucose, that's an illusion. Why? Because long before your glucose levels ever spike into the prediabetes or type 2 diabetes range, your insulin is already working overtime. Your cells start ignoring it. That's insulin resistance. So to overcompensate, your beta cells pump out maybe 10 times more insulin just to keep your blood sugar looking decent. This chronically high insulin state is called hyperinsulinemia. And since insulin isn't on your standard metabolic panel, this huge underlying dysfunction just goes totally undetected, literally for years or even decades.
And this brilliantly illustrates what happens when that cellular engine breaks down. Insulin resistance isn't just about diabetes, folks. We're talking about the root cause of almost every chronic disease associated with aging. In your brain, it contributes to migraines, stroke risk, and dementia. Heck, Alzheimer's is often referred to as type 3 diabetes nowadays. It drives heart disease and hypertension. It messes with sex hormones, leading to PCOS in women and erectile dysfunction in men, which is actually one of the earliest warning signs. It's the core driver of fatty liver disease and even fuels the growth of certain cancers. It's essentially a total systemic collapse of cellular energy.
Section 2. The cellular solution. Okay, so here's the million-dollar question. How do we actually fix this massive systemic damage and bring energy and blood flow back to these starving tissues?
Enter hyperbaric oxygen therapy, or HBOT. Now, to be clear, this isn't just taking some deep breaths from an oxygen mask at normal air pressure. This is a targeted medical treatment. It literally transforms oxygen from a basic survival gas into a highly potent dual-component drug. By combining 100% pure oxygen with increased atmospheric pressure inside a specialized chamber, you're changing the physical state of the gas inside your body. It works at a genetic level to turn on healing pathways and shut down inflammation.
So why does the extra pressure matter? Well, at just 1.5 atmospheres absolute, which is basically 1.5 times the normal pressure at sea level, breathing pure oxygen increases the amount of oxygen dissolved right into your blood plasma by about 10-fold. 10-fold! Normally, practically all your oxygen is hitching a ride on red blood cells bound to hemoglobin, but under hyperbaric pressure, the oxygen dissolves directly into the liquid of your blood, entirely bypassing the need for those red blood cells. That means oxygen can be forced into damaged, swollen, or hypoxic tissues where red blood cells are literally just too big to fit.
Moving on to Section 3, the hyperoxic-hypoaxic paradox. Now, flooding cells with oxygen is fantastic, but the real magic comes from a totally fascinating biological trick. Let's look at what makes this so regenerative.
This paradox is basically the ultimate physiological switch. Normally, when your body senses a lack of oxygen, a state called hypoxia, it panics. It triggers this massive regenerative response to save your tissues, like building brand new blood vessels. The problem? Actual hypoxia damages and kills your cells. But with the hyperoxic-hypopaxic paradox, we intermittently expose the body to massive amounts of oxygen during HBOT and then drop it back to normal air. Your cells get tricked. They interpret that sudden relative drop in oxygen as a state of hypoxia. It's like an adaptive workout for your cells. It triggers regenerative genes, especially the HIF-1 alpha gene, giving you all the incredible healing benefits of oxygen starvation, but in a completely safe, super-oxygenated environment.
Let's break down how this biological sequence builds step by step.
First, you breathe the pressurized pure oxygen. Second, your plasma oxygen levels just absolutely skyrocket, flushing out metabolic waste and restoring energy. Third, the intermittent nature of the treatment triggers that HIF-1 alpha gene we just talked about. And fourth, boom, the magic happens. Your bone marrow gets the signal to mobilize a massive wave of stem cells right into your bloodstream, while simultaneously, a process called angiogenesis begins, literally sprouting brand new blood vessels to permanently restore blood flow to damaged tissues.
Section 4. Healing the damage. Let's look at the real-world clinical outcomes when we repair this broken cellular engine with targeted HBOT protocols. What happens when we apply this to patients suffering from severe chronic conditions? This data really maps out the sheer, undeniable power of HBOT across some seriously severe conditions. For cancer survivors dealing with delayed radiation complications, where the radiation permanently destroyed local blood vessels, HBOT reverses the tissue hypoxia, hitting a massive 65 to 85% success rate for things like jawbone tissue death. For diabetic foot ulcers, which are caused by that exact metabolic syndrome and insulin resistance we discussed earlier, HBOT stimulates new blood vessel growth, healing the wounds and saving people from amputations. And honestly, perhaps the most mind-blowing part? For age-related cognitive decline and stroke rehab, this pressurized oxygen forces its way right into dormant brain tissue. It induces neuroplasticity and builds new neural pathways, leading to some truly profound cognitive improvements.
Which brings us to Section 5, reversing biological aging. Because what if HBOT could do more than just heal specific injuries or diseases? What if it could target the actual physical degradation of our bodies and turn back the biological clock?
Check out the results from this groundbreaking 2020 study on healthy aging adults. Biological aging is basically driven by two main things: the shortening of your telomeres, which are like the protective plastic caps on the ends of your chromosomes, and the buildup of senescent cells. These are often called zombie cells because they stop dividing but just refuse to die, and instead sit there spewing inflammation. Well, the research showed that specialized daily HBOT protocols actually caused a significant increase in telomere length, up to 20%, and simultaneously drove a massive decrease in those toxic zombie cells.
Let that sink in for a second. I actually want to read this quote directly because it is such a monumental finding. HBOT protocols can significantly increase telomere length and reduce the number of senescent cells, marking the first time a therapeutic intervention has been proven to reverse these two hallmarks of aging biology in humans. By harnessing this hyperoxic-hypoxic paradox, we're not just slowing down the aging process. At the cellular level, we are literally reversing it. We're making those cells act like they did decades ago. So, I'm going to leave you with this final thought to ponder as we completely rethink the future of medicine. We started off by looking at how undetected insulin resistance is this silent killer, suffocating our cells and driving systemic disease. But then we saw the ultimate cellular solution: how manipulating something as simple as oxygen and atmospheric pressure can trick our bodies into this profound state of regeneration, growing new blood vessels, mobilizing stem cells, and literally reversing the hallmarks of aging. If we can achieve all of this just by unlocking the body's own innate healing mechanisms, what are the true limits of human health and longevity? Thanks for joining me for this explainer, and keep questioning everything.